How does migraine aura work neurologically? Have you ever experienced a strange visual disturbance before a migraine hits? This phenomenon is known as migraine aura, and it has a fascinating neurological basis. Let's break it down. Migraine aura is primarily caused by a process called cortical spreading depression. This is a wave of activity that moves across the brain's surface, particularly affecting the visual cortex. When this wave occurs, it disrupts normal brain function and blood flow. This disruption leads to the temporary symptoms we recognize as aura, such as seeing flashes of light or experiencing sensory changes. The process starts with a specific area in the brain becoming overly active, which increases blood flow. This is followed by a decrease in activity and blood flow that spreads slowly across the cortex. This wave travels at a speed of about 3 to 5 millimeters per minute. As it moves, it correlates with the symptoms of aura, especially those related to vision. Research using functional imaging has shown these changes in blood flow and electrical activity during aura episodes. This supports the idea that cortical spreading depression is the main mechanism behind these symptoms. From a neurological standpoint, this process also activates the trigeminovascular system. This system includes sensory neurons from the trigeminal nerve, which supplies the meninges and blood vessels in the brain. When activated, it releases inflammatory substances that contribute to the headache phase of a migraine. The brainstem and areas like the hypothalamus play a role early in the migraine process. They influence how the brain reacts to cortical spreading depression and help modulate sensory processing. Sometimes, the aura and headache can occur separately, indicating that different but related processes are at work during a migraine attack. Understanding how migraine aura functions neurologically is essential for treatment. Neurologists can use this knowledge to develop strategies that target brain activity and the trigeminovascular system. Treatments may include medications that stabilize neuronal activity or block certain receptors to prevent or lessen migraine attacks. Recognizing aura symptoms also helps neurologists distinguish migraines from other conditions, allowing for better patient management. So, the next time you experience a migraine aura, you will have a clearer picture of what is happening in your brain.